Yeah, right, exactly.
So we're awake, we're ready to go.
I know people probably be like, "What are you doing?"
I know. Patrick, I was like, I can't see anything.
Let's see. When the stream starts, it says live. Up, it's being streamed at Facebook Live. Let's see, we're live. Thank you. We are officially live. Thank you, Dr. Laufer. We're going to give everyone a second to join us here. Uh, we are sorry, everyone, for the technical difficulties. We had some issues with Facebook tonight, but nonetheless, we are live. We're going to give everyone a moment to join us here before we get started. We have a very, very, very special guest with us tonight. We're going to have a very great conversation about how we're going to be able to accomplish and make it through COVID-19 together. So thank you, everyone. We're going to give you everyone another minute to join us. Welcome to another branding briefing where we've been discussing what you need to know about COVID-19 continuously. If this is your first time tuning in, I'm City Council President Brandon Scott. Today, we're being joined by another very special guest, Dr. Miriam Laufer, who is a pediatric infectious disease doctor at the University of Maryland. Dr. Laufer, hello, and thank you for joining us.
It's great to be here. Thanks for having me.
Thank you. Tonight, everyone, we're going to discuss her work as a pediatric infectious disease specialist and epidemiologist. She is the principal investigator on important COVID research underway right now at the University of Maryland School of Medicine, leading a clinical trial to determine how to best stop COVID-19 from spreading within households. Dr. Laufer has devoted her career to developing strategies to prevent infectious and vulnerable diseases in vulnerable populations, including young children, pregnant women, and people living with HIV infection. So, but before we go there, and here, as you often hear from me every day, I say, listen to the public health professional. So tonight, you will have the direct chance to listen to a public health professional and ask the public health professional, one of our great leading ones here in Baltimore, questions. But before we go there, I just wanted to share the latest COVID totals for the state of Maryland and Baltimore as of this morning. And easy, everyone. It's easy to stop and tune out hearing these numbers, but we have to remember they are much greater than numbers. These are lives, these are people's siblings, these are people's parents and children. We all have a role to play in stopping the spread of COVID-19, especially for our seniors and the people living with compromised immune systems or pre-existing conditions. As of this morning, uh, as of this morning, we now have 14,775 cases in Maryland, a total of 631 deaths statewide, 1,602 confirmed cases here in the city of Baltimore, and 58 of the 631 COVID-related deaths here in Baltimore City. But now, everyone, again, I want to introduce to you Dr. Laufer, our special guest for this evening, and want to get straight into some conversation with our guest. But first, want to allow her to introduce herself to you and everyone else out there who might not know about the great work that she does. So, Dr. Laufer, the floor is yours for a second.
Thanks so much. It's great to be here. So, council president, I've known as Brandon for a long time because my husband used to be a teacher at Mervo, where the current council president was a high school student, and he also taught three of my kids to love football. So I'm very grateful. I'm excited to be the last of my family to meet him. So thanks for having me here. For all of us in infectious diseases, when COVID hit, even before it was the thing we talked about every single day, every single minute, we dropped everything and realized that everybody who does any kind of infectious disease research, clinical care, we all need to drop everything and start to address this. It's an unprecedented challenge, but I also want to point out it's not going to be the last pandemic. So everything that we do for this infection and disease that has hit us so hard is going to prepare us for future challenges. And I think we're going to be much stronger for the next challenge, whether it's a resurgence of COVID or another infection that comes along. So one of the things that I'm focusing on right now is looking at how do we stop the spread of COVID. So certainly the thing we need to do is to prevent it altogether, and that will be done when we have a vaccine. A vaccine is a little ways away, and we can talk about that later. But in the meantime, what are the tools we have at hand that we can use to prevent the spread? Most commonly, spread of COVID is from very close contact. So that is mostly within households. So we know that once one person in a household gets an infection, it's very likely that a few people in that household will then go on to get an infection. And that's not uncommon for other infectious diseases. And what we do for other infectious diseases is we treat people in the household. It's called post-exposure prophylaxis. So after someone in the household has been exposed, we give them medicine in the hopes that they do not go on to get infection. So what we're doing now is a study to see if one of the medicines that we think might work against COVID-19, that's hydroxychloroquine, to see if when we identify people in someone who has a new COVID-19 infection, we're trying to see if giving hydroxychloroquine to their household members prevents the household members from getting infection and getting disease. And this may be an important tool that we can use to prevent the spread of COVID in general, and also an important tool for us to use when we're ready to start opening up a little bit more, having some businesses open again. And this might be something that can make us safer as we start to go back towards something that's closer to normal life.
Yeah, and thank you for that. I think that is critical information, and you've been helping to organize the pediatric response and other work at the University of Maryland. So I want to first say thank you for you and your team and all of our healthcare workers for keeping everything you do to keep us safe and healthy, but also putting yourselves at risk. And you mentioned the start of an important research study to prevent the spread of COVID within households. Can you talk about the trials that your team conducted to determine how to best stop it? But also, can you also talk about how important that is and where the research says how this has helped this disease spread around the world and around the globe, and how in a place like Baltimore, where it's hard for some people to self-quarantine away from their family just based on living conditions, how important this kind of research is in order for us to stop and slow down the spread of COVID-19.
I think you're exactly right. You hit the nail on the head. So there's one thing I want to say, which is we, as the city of Baltimore and really the entire state of Maryland, have done an amazing job. There are two things we have done to slow down the spread of COVID-19. One is we've improved our healthcare system and ramped it up, and that's really been to manage the severe disease and prevent deaths. And the other thing we've done is we have, for the most part, followed the rules of social distancing, or what I like to call physical distancing. And that has made an unbelievable difference. We don't have a vaccine yet. We don't have treatment yet. We have better testing, but not universal testing. And with all those things, we've been able, through just our behavior, the people of the state and the people of this city have slowed down the spread of COVID. I think it's amazing. It's amazing that we've all sort of come together and made this amazing progress. And I don't know that people knew that we would be able to do it, but we did. So I think it's a remarkable thing, and I feel very proud to be here in Baltimore, where people have done an amazing job. So you also point out that for some people, it is extremely challenging to practice social distancing or physical distancing. And in some cases, especially when one person in the household gets sick, it's just not an option for people to move out or to leave the person by themselves. We talk about, there's a parent who has to take care of a child. There's a family member who has to take care of an elderly person. There's very crowded housing. These things can happen. So the study that we're doing, and the information about it is on our website, which I know will be up on the chat area. It's covidpepstudy.org, covidpepstudy.org. And you can also find it on the Center for Vaccine Development and Global Health website. Will be very important for settings where the spread of COVID cannot be controlled through distancing. So it includes people, when you have, again, a parent take care of a sick child, you have crowded living conditions. These are the situations where we don't have all the options in the world to say, well, send someone away to another house. And so we can figure out a way in the current conditions to prevent the spread of the infection and the disease.
Thank you. And I think that this is great and important work. And when people are talking about those kind of protections and best practices, I often always like to ask folks like yourself, what are the ways that you've been doing it? What are some of the ways that you've been keeping your family safe and protected during this time as you find yourself right on the front lines of this pandemic? And what advice do you have for our other essential workers, our nurses, our trashmen, people that are cleaning buildings, police, fire? What kind of things that you have advice for them of what they can do to protect themselves, those who work in grocery stores each and every day, and in their families that they're exposed more than most people to COVID-19?
It's a great question, and it's a huge challenge. Many of us, even in healthcare, we were never, never ever wanted to be called a hero. And certainly people are in positions right now where they are essential workers, and they're helping to keep us fed and warm and trash picked up. And they are putting themselves every day at risk compared to all the people who have the luxury of being able to stay at home. So what do we do? One thing is to be as meticulous as you can be about maintaining the physical distancing in any setting where you can be. I think it's taken a little while, but things like stores, grocery stores, and restaurants have accommodated the need to maintain the social distancing. We know about wearing masks, and wearing the cloth masks isn't really to protect you from other people. It's to protect other people from you in case you have infection and you don't know it. We call that asymptomatic infection. Honestly, we don't know how common it is, but when you wear a mask, you're making sure you're not spreading the infection to someone else. It's not protecting you. So that's a very important thing to remember. The other thing that's important is making sure you're keeping track of washing your hands. So when you're in a situation where you think you could be exposed to a virus, and again, it's not because anybody thinks it wants to do anything malicious. It's not because anybody's walking around sick. It's because some people, any of us could have the infection and we're not sick with it. Whenever you're coming back home, when you're going to eat your meals, going to prepare other people's foods, make sure you wash your hands with soap for at least 20 seconds. 20 seconds is longer than you think it is. I have a running joke with my kids that, I have the timer set for 20 seconds and they come out. And I was like, how long do you think it was? Oh, definitely 30 seconds, Mom. And of course, it was like 10. So longer than you think you should, but wash your hands carefully. And then the last thing to do is to be very attentive to your own personal health. So many of us, especially those of us in these essential jobs, are used to saying, oh, actually, I'm okay, or I can make it through the day, or I don't want to, especially now, you don't want to call on your colleagues to come in and work for you because nobody really wants to come into work. So, but it is important not just for you and the one person you meet, but for the spread of this entire epidemic in our area, is to make sure that if you're not feeling well, you stay home. You stay home and monitor yourself. If you get a fever, then you stay home for your 14 days. Or you stay home until the fever's gone, and then at least 3 or 4 days after that. If you are so sick that you need medical attention, then you go to the emergency room. Let them know right away that you think you have a fever and respiratory symptoms, so they put a mask on you and put you in the right place. But the most important thing, really, for preventing the spread for those of us who have to go out and work, is to make sure that you're honest with yourself. That if you're not feeling well, you do stay home. So they just instituted here at the University of Maryland, where every employee who comes into the hospital gets your temperature taken every day, just to make sure that nobody who's sick is coming in. It's not perfect, but it will help to identify people early when they're sick early in the infection.
Thank you. And Doctor, I'm glad you brought that up because I actually made that suggestion that the mayor institute that at the city, and folks said, well, what is that going to do? Some people don't have the symptoms of a fever. I said, but many people do, and we have to do everything that we can do in this crisis to try to protect as many people as possible. And this is something that I hear, and I talk about it a lot, right? These next two things, right? I talk about them a lot. One, first and foremost, I hear people ask, is physical distancing, is social distancing really an effective tool? And I say it consistently, but I wanted to hear from you about how physical distancing from a public health professional, how that helps with COVID-19.
So as I mentioned before, there are many ways, there are probably a lot of ways to get COVID infection, and you can spend a lot of time online hearing about the best way to deal with your boxes from Amazon and what to do with your groceries. And I'm not saying that those are or are not necessary, but what we know definitively, what the data show, is that the way that COVID is most efficiently spread is with close contact. And what does that mean? So that means that the more close you are and the more time you spend close by, the more likely you are to get infected. So the virus is spread through respiratory droplets, which they come out a lot more when you're coughing because the virus lives in your lungs and in your respiratory tract. But it even, it's coming out now here while I'm speaking. And those respiratory droplets can travel a few feet, probably up to about 6 feet. So if you are at least 6 feet away from the person next to you, for the most part, if they have an infection, it will not reach you. So we don't know who's infected. Anybody could be infected. They could be infected and not sick. They could be starting to get sick. They could be sick tomorrow. So by staying away from everybody again who's not in your household, then that's the way to prevent infection to spread from one person to another. Our study will be looking at how to prevent the spread once if people are in the same household and they've already been closer together for a long period of time. That's inevitable. It's impossible to ask households to maintain 6 feet distance. You say your house is one unit, and we're trying to figure out how to keep people protected within that unit. The physical distancing, it really has been the key. We've seen it in China and South Korea. We've seen it on the West Coast, and I think we're seeing it here. It's very hard we don't know what things would have looked like if we had not early on instituted the physical distancing, closing the schools, closing non-essential businesses. But I really think that we were on the path for something that was beyond our imagination tragic, like what happened in New York. And we don't know yet, but I think we've somewhat averted it from being such a big disaster. And I think it was because we instituted these non-pharmacological interventions very early on.
Thank you. And thank you for that point. And the next thing, every day when I do these, I get questions about when are we going to open the state up and when are we going to open places back up? And I remind people every day that we aren't out of the woods of this pandemic, even though we put these practices in place that helped us, as you just alluded to. Can you talk about a few things like where are we in treating COVID-19 from your point, and talk about the different therapies being researched, but also about vaccine research and how long that process takes, and when you think that we can honestly expect to see a vaccine?
Right. So those are all very good questions. I'm going to start from the most intensive intervention to the most public health oriented intervention. So right now, where we are probably the farthest along is using medicine, although we're still not very far along, is using medicine to treat severe disease. There are several drugs that might be beneficial to really help the people who have the most severe disease, where their lungs are truly failing and they're at very high risk of death. Those drugs include hydroxychloroquine, remdesivir, other antiviral agents, and they are being studied to evaluate whether or not they're beneficial and whether or not they're safe. We honestly don't know, and the reason we don't know is because this infection happened very quickly and people just did the best they could without thinking ahead of time about how would you design a study to answer the question, right? If you take 20 people and you give them medicine and you look at their outcome, do you know that their outcome is due to the medicine, or was that outcome going to happen no matter what? We don't know. We need what's called a control group. So the studies now are being designed the way we want them to be designed. We're doing studies here at the University of Maryland to look at some of the leading candidates for the treatment of severe disease. And we'll have more information about what are the safety concerns, what is the expected efficacy, and for the treatment of severe disease. the next group of interventions would be medicines to prevent the spread of COVID-19. Right now, the drug that's being studied is hydroxychloroquine. We're doing the study here to look at household exposures. Other groups are studying using hydroxychloroquine in healthcare workers to see if that's a way to keep them safe. So that's another intervention. It's prevention, but it's using medicine that you have to take every day. And then the real answer, I think, to get rid of COVID will be the development of an effective vaccine. And we're not in terribly bad shape for a COVID-19 vaccine. Part of the reason for that is we've seen viruses like this before with SARS and MERS. And I'll say, you know, those infections came out, people started making vaccines, the infections went away. And so nobody wanted to pursue making the vaccine, which means we had a lot of candidates, but nothing had gone very far. So what do we need to do now? We need to find the right vaccine that will induce an immune response, so make your body react to COVID-19 to protect you against infection. We need to start giving it to people. The very first vaccine trials, first in human vaccine trials happened a few months ago. Next week or so, we're starting another, one of the leading candidates will be trialed here at the University of Maryland Center for Vaccine Development. And then from there, we need to see if it's safe. We see if it is immunogenic, if it induces a good response, and then we need to see whether or not it protects. And after that, once we find that it's safe, it produces an immune response and it protects, then enough of it has to be made to be distributed to the entire population. That is a long process. The estimates are just estimates based on this is how long these kinds of things usually take. It could be faster if things go perfectly. It could go longer if there's more challenges than we expect. But it's not an answer to what's going to happen to get, for example, kids back to school in September. We're not going to have it by then.
Thank you. Thank you. And I want to, the next thing, and we're going to go to questions in just 1 second, everybody. But that's the next question I wanted to ask you is talk about this is an extremely confusing time for everyone. So we have to imagine how hurt and confused our children must be when their parents are not allowing them to go to school, to play dates, they haven't seen their friends, they can't take a trip to the park, they can't go to the baseball game, Little League season is canceled. What do you, this is something we get consistently on our live updates. What do you recommend parents and how they can explain to their young people what's happening right now, and which a way that is very sensitive to young people and that also conveys how serious the situation is without just scaring them to death?
It's a good challenge. And I mean, it's an important challenge. And there are a few things to say. And I say this because what I'm going to say is true for children and for adults. In some ways, we're all scared children here because we don't know what to expect. We're in uncharted territory, and you know, it's a little bit like seeing things as if you're a kid. Not to mention, as adults, we're bombarded with information and over information. I'm not going to say sensationalism because it's not that it's untrue. It's just so much information. It's hard to ever talk about anything else. So you have to. I think everybody recognizes the severity of COVID, but you also have to recognize that each individual's risk of COVID infection is pretty low. I mean, in the end, maybe we'll end up with 2 to 5% of the population ever having had COVID. So that's what based on serological testing. So most people aren't going to get it. So your risk as any individual of getting very sick with COVID is quite low, although it's a very severe disease. But I think this is a really amazing time to teach kids the power of their action. You know, we try and teach kids to be responsible and to do the right thing because of contributing to the greater good. But this is a live, in your face, see it every day example of adults and children, people who get along, people who don't get along. Everybody's just staying home. I mean, everybody who can, right, is just staying home, staying out of stores, not getting together with friends, in order to keep the entire community healthy. So I think if we can focus on that, I mean, it's so amazing that even these kids, even if when you have to say, no, you can't go to your friend's house, or no, you can't go play basketball at the neighborhood basketball court, it's because you're actually making a difference. So I think it's a way to make children feel that they're empowered to have some agency over what's happening. I think it's a great opportunity.
Yeah, thank you. And just a reminder for everyone watching, be sure to give us your comments, your questions in the comment section. We will begin to answer them. Doctor, I also wanted to talk to you about something else. We've heard from the CDC and other folks about the possibility of a second outbreak, and the second wave could be a few months away. Can you talk to people about that and why this is important that we continuously follow the advice of you guys, because this is something that may come back in the future, and is there anything that we can do to deal with, to either avoid or deal with the resurgence of COVID in the future?
Yeah. So patience. So we don't know, right? I don't know the answer to that. I don't know what will happen with COVID, how quickly it will go away. If it starts to go away and we start to open things up, will it come back? I don't know. I'll tell you that, and I mean, honestly, nobody knows. We have better educated guesses and less well-educated guesses. So what are we going to have to do differently? I call it the COVID redo, right? So we start opening up, and we start to see that things are going in the right direction. What are the tools that we need to have at hand immediately, so we don't end up in the situation again where we have 3 months when the city is, the country basically is locked down. One, we need surveillance. We need lots and lots of testing, and the ability to identify contacts of people who are positive. I am very heartened by what's going on in our state. The University of Maryland is developing the capacity to do 20,000 tests. There's a plan to do extensive contact tracing, especially in the hardest hit areas. So I think we're going to have the tools to do surveillance. We need options for people who are infected, to treat them so that they are less infectious, to prevent them from getting disease, and if they get disease, to prevent them from getting very sick and from dying. Those, again, as I mentioned, are the various clinical trials that are underway right now, using hydroxychloroquine to prevent spread, and using some of these other medicines to treat severe disease. And then finally, at some point in the medium-term future, we'll have to have a vaccine that will allow us to really put this behind us and not have to worry about it anymore. Sort of put it in the realm of measles and diphtheria, diseases that, as long as we get our vaccine, we are mostly protected. So there are tools that are emerging now. There are tools that we will have, and that's what will allow us to be smarter the next time either a COVID pandemic happens or some other infection enters into the scene.
Thank you. And I think that leads me into one of our questions that we have, because it's something that we deal with a lot when we're doing these live briefings. There's a lot of misinformation that's going out there about coronavirus, its origins, the magnitude of it, who can get it, who can't get it, who's immune, who's not immune. And I tell people each and every day that everyone can get it, that anyone can contract it, and that it's important that you're only sharing information and listening to the advice of public officials who are following the advice of public health professionals or the public health professionals themselves. What, from a public health standpoint, would you say or tell people as a doctor, about this misinformation, about spreading information that may or may not be true? How important is it for people to validate information during a crisis like this?
Oh, it's so important. And we're in amazing times in terms of access to information. Everybody can be an information provider as well as an information consumer. And you have to be so careful about where the sources of information are coming from. And I think, especially now, because we are learning new things every day. And so if you're not going to a reliable source, you don't know if that unbelievable piece of information, or that information that you haven't heard before, is it new information or is it someone who made it up? It's much harder to distinguish those when new information is coming out every day. So I really actually feel for the public of, where are you supposed to get your information from? And I think you're right. We need to stick with the reputable sources, the city, the state, the CDC. I'll tell you, I'm mostly in my clinical work, I mostly take care of children, and we have a children and COVID-19 website from the Center for Vaccine Development and Global Health at the University of Maryland, where you can there's a whole list of all of the most updated information about COVID. There's links that are especially for parents, some that are for our pediatricians, and we try to keep it updated with reliable sources of information. So it's an especially challenging time to make sure your information is correct. There is an unbelievable amount of misinformation available on the website, and that I hear people talking about all the time, and not just people, including people who are in science and medicine. So sticking with your reliable sources will give you the information that is supported by the data.
Doc, that website, do you have that website so we can list it in for people, the one that you were just referencing?
Sure. If you go to the Center for Vaccine Development and Global Health, I can't remember it offhand, but I'm sure that they'll find it there. There's a link that says COVID and kids.
Yeah, we'll make sure, and we'll be sure to keep uplifting that, as people often ask questions about their young people. So I have a question actually from someone who's an essential worker. It just happens to be my mom, who works in a grocery store. What kind of things, and she's doing some stuff and just wants to make sure that they're following the right things. So of course they have masks, PPE, all of that stuff. But when they're in an environment like the one that they're in, and she actually works in a grocery store in Baltimore's highest zip code for COVID-19, what kind of advice would you give to a worker like that on how to try to protect themselves even further, especially with having to go home consistently and not to spread it to other members of the family?
Yeah, I mean, so I worry about that, and everybody really worries about that. Um, my friends in New York said everybody understood that doctors and nurses would take off all their clothes in the hallway of their apartment buildings before they would go in, and everyone would just look aside. So I think there are I think it's sort of the same thing as I said before about people protecting themselves. So stores have been better now about allowing employees to keep their distance from other people, and giving people masks and gloves. I think the other things in addition to what I mentioned was very frequent hand washing is important, because you're touching all the different things that people have touched. And so again, we haven't seen massive outbreaks from grocery stores. So the risk is there, but it's not an overwhelming risk. So keeping your hands clean, changing your clothes before you go back home, taking a shower when you go back home, I think are some of the things. I have for the doctors who take care of a lot of patients with COVID, and since I'm in pediatrics, I'm very fortunate. I don't have huge numbers of patients with COVID, but they do have recommendations that mostly include lots of hand washing, taking your clothes off and keeping them, either putting them straight in the groceries in the washing machine, or leaving them outside the house, so that you're not bringing any fibers that could have COVID on them home, and then meticulous cleanliness.
Thank you. Thank you. The next question, and I'll take this one, is how do you report unsafe practices in stores? The person is having issues with stores and say they're not getting help with the police. First and foremost, we want you to always report that to 311. And then also, if you're not getting the response that you should be getting, make sure that you are contacting my office, either by sending us a message here on Facebook, or simply calling 410-396-4804. Again, that's 410-396-4804. Or you can always email us, councilpresident@baltimorecity.gov. Again, that's councilpresident@baltimorecity.gov. Dr. Laufer, you talked about something that I've been talking about, and that folks talk about with us on these lives consistently. We know how important contract tracing is, and especially in our hardest hit neighborhoods. I talk about that often through a lens of equity and understanding Baltimore as a city, really here in Baltimore's history of inequity, and how the inequity, racial inequity, structural inequity has led to pre-existing conditions and health disparities. Can you talk about, from a health professional's point of view, why you believe that those areas that are the hardest hits are important for us to focus on and focus with testing and contact tracing during this crisis?
Well, I mean, I think just as you said, with the history of health inequity, that it's important to be proactive in making sure that we're not waiting for populations that wouldn't normally access healthcare to access healthcare. So you can easily miscount, right? If you have people who are staying home when they're sick and not seeking out medical care, you wouldn't know how much of any disease exists. In addition, as you said, there are a lot of populations that suffer from a disproportionate amount of exactly the preconditions that are associated with more severe coronavirus infection. So diabetes, hypertension, heart problems. So these are groups that not only would access healthcare on their own less, but are also the highest risk for having severe disease. So I think it's incredibly important to be proactive. And I think, as we've discussed previously, there is a certain amount of privilege associated with the public health professionals, including my recommendation that people should maintain social distancing and quarantine themselves if they're sick. It, it, you know, it's not possible for a lot of people. If you live in a crowded environment, if you live in a homeless shelter, if you don't have a home and you're going from one place to another, our prisons are suffering enormously from the spread of COVID. So there are a lot of populations where the non-pharmacological interventions are just not feasible. And ultimately, we should work to make it possible. Everybody should live in a world in which they can stay 6 feet away from somebody else in their house. But until then, we need to make sure that we are doing the right thing by our population in Baltimore City, and that is aggressively finding cases, treating them if needed, hospitalizing if needed, and identifying how we can prevent the spread in these more crowded conditions.
Thank you, and thank you. I think that's a very critical point. Dr. Laufer, we don't want to keep you all night. I could continue, and we know we'll continue to have questions come in. We want to be very respectful of your time. But before we end, I wanted to allow and check in with you, allow you to say any other things that you think are important that we didn't cover. Before we move forward, I have one more thing that I want to highlight before we end, but wanted to give you the floor to talk about anything related to COVID or anything else in the public health profession they think is critical for people to know as we maneuver through this crisis.
Great. So thanks for the opportunity to say that. I do believe that I hope that people feel as empowered as they are to make a difference in public health. I know sometimes we feel that we can't, we're struggling against so many things and that we can't make a difference, but this is really a way that every individual has been able to make a difference and at least mitigate the severity of this COVID pandemic here in Baltimore. But we need more tools, right? We need tools to identify everybody who is infected, to prevent the spread from infected people to not infected people, to prevent the infection altogether. And so even if it seems like things start to get better and COVID infection is starting to go away, we don't want to miss this opportunity to be prepared for either a resurgence of this infection, as many are predicting may happen, or the next time something like this comes along. Because one thing we know for sure is this is not the last infectious disease that's going to hit us hard. And so we need to be ready with the tools for this infection and for future infections.
Thank you. I think, Dr. Laufer, I want to say thank you for all your great information and all your time tonight. I want to ask you two more things. One is, which I think is the most important question I'm going to ask you tonight. How are you and your family doing? How is my wonderful former teacher doing? How are my former athletes doing? How are you guys moving through COVID-19? And what are you guys doing as a family to kind of decompress from all this, especially with you being on the front lines with school being closed and everyone in distance learning? How are you guys doing and feeling throughout this process?
Well, I have to say here publicly that our little homeschool with the three boys, Jonah, Brady, and Caleb, and the headmaster Mr. Daniels are amazing. And I want to add that my mother, who lives in Philadelphia, when this all started, I decided I didn't want her to be all by herself in Philadelphia. So we brought her, Patrick actually drove up and brought her to Baltimore, and she's been with us for about a month and a half. So we have a little school going where I'm in charge of PE and Spanish. My mother does music and French, and the headmaster teaches everything else. And they have been absolutely amazing. It is very hard. I think the stress of COVID, the stress of being at home, of trying to maintain, both of us maintain our work, because of course, not only is Patrick the headmaster of our little homeschool, but he also has 150 students at City College that need to be taught. And for us all to be together all of the time, it's a little bit of a pressure cooker, but we've identified some things we like to do together. You know, we like to do world domination with a game of Risk, or we have some TV shows we like to watch. And so, oh, you'll like this one. We're watching All American on Netflix.
Yeah, on Netflix. Yeah, that's a good one.
So we've been enjoying that.
The boys probably picked that one, right?
Well, we picked it because we thought they would like it. They insisted that they hate watching TV. They only want to watch movies, but now they love it every night. Is it all night? So we try and find things. We could try and give everybody some time by themselves, and also find things that we like to do together.
Yeah, and then one last thing for you. I know that you and your team are looking for volunteers who have been diagnosed with COVID, or live with someone who's been diagnosed with the infection. Do you want to talk more about that? We're going to be sure to share the information about the study, but do you want to talk more about that? And we have the website link that we will put in as well.
Great. Yeah. So as I said before, we're doing a study to look and see if we can stop the spread of COVID from people who have infection in the household to their household members, which is the most common way that COVID is spread. And so what we're looking for are for individuals who had a recent infection, recent within the last 3 days, and their household members who they've lived with for at least the past 2 weeks, to enroll together. And what happens is we randomize them, which means some people will get hydroxychloroquine every day for 14 days, and some people will get vitamins for every day for 14 days. And what we'll ask you to do is take your medicine every day, swab your nose to see if you have infection, and answer some questions online. It's all virtual. You don't have to come anywhere. That when we first enroll you, we do a video chat like this. We ask you some medical questions, make sure there's no reason you shouldn't be in the study. And then everything that you do is through answering questions online. And then if you have any problems, you just call us or we call you, and we go over any challenges. So it goes on for 14 days. We have a courier come to your house and pick up all the specimens that you collect, and then we see you, and then you do one more collection and one more questionnaire at day 28, and then you're done. So the website I know you have up there, you can look at the Center for Vaccine Development and Global Health website, or covidpepstudy.org for more information, and you can sign up, which doesn't obligate you to participate, but it'll have someone call you back so you can answer more questions.
Yep, and we actually have a short link too. It's bit.ly/Laufer, LAUFER volunteer. We'll be sure to share that as well. Doctor, I want to say thank you. Thank you so much for joining us. This was a great informative session. We might call you back if things change, because we always want to be able to have people hear directly from our public health professionals. Thank you for all that you do. As always, give my love to the family, especially the boys. I know how it is to have Mr. Daniels as a teacher, so I know that they're going through it. But please stay safe and continue to do great work for the city of Baltimore and everyone in the world as you guys are leading on COVID-19. So thank you so much.
Thanks. Pleasure to be here.
Thank you. Thank you. Good night, everybody.